Hi everyone, it's Kim Vopni, the Vagina Coach, and in this video we're going to be talking about Kegels in pregnancy. Should you do them or shouldn't you do them? And my answer is yes, you should, but there is a caveat there, and we're going to talk about that in this video. We're talking about Kegels in pregnancy. So we have our pelvis model here, and in pregnancy, our uterus is growing up and then out in front of us. And what that does is it shifts the center of gravity, which we try to accommodate with different positioning of our pelvis. We need pelvic floor muscles that can respond to those changes. And we also have an ever increasing load on the pelvic floor. So we want to have muscles, pelvic floor muscles that are strong, that can withstand that ever increasing load. But we also want pelvic floor muscles that are supple and that can release tension and that can find ease and surrender and relax as well. So we need strong, supple muscles. So Kegels in pregnancy are important, and they will help keep those muscles strong and able to withstand all of those changes that are happening. And they also play a role in birth as well. So as the babe is descending into the pelvis, when their head reaches the pelvic floor, there needs to be a little bit of tone in those muscles, and that is kind of what helps guide the babe into those rotations, the movements, the cardinal movements of birth. We want to make sure, though, that the pelvic floor can also respond by opening, because at the end of the day, we need this space to be able to open freely so that the babe can pass through. So there's the sphincter law that happens in birth as well, in labor, and we need, the sphincter law is essentially that the sphincters need to stay closed when we don't want something to come out, and we need them to be able to open when we do. So during birth, our cervix is opening, and we need to have also pelvic floor muscles that respond in the same way so that there's not as much tension in the pelvic floor that might be creating resistance for the baby. So we're going to talk about the attachment points here. So the pubic joint, the two sits bones, and the coccyx, or the tailbone at the back. That's the diamond shape, or the group of muscles that we're talking about. But I'm going to get my other pelvis to help demonstrate a point here. So here is the pelvis without the muscles. So we have this open space here. And here is the attachment point at the base of the spine, at the sacrum, base of the sacrum, the coccyx. We have the two ischial tuberosities, and then we have the pubic joint at the front. We have a little bit of movement in the joint here at the front, as well as in the SI joint. We have a little bit of movement there. This would be considered the pelvic inlet. This would be considered the pelvic outlet. So in early labor, we want to create more space in the inlet, and you can do that by actually sitting in a tucked position. So when you sit, if you watch the bone here, if you sit and kind of tuck the tailbone under, it can create a little bit more space here by flattening out the back and bringing that tailbone underneath. But when it comes time to push in the second stage of labor, we need that sacrum and tailbone to get out of the way. So here, tucked positions or fixed positions, such as lying on the back or even a semi-reclined position on the bed, can actually lock that joint in place and not allow for movement to happen. So if we want as much space here in the outlet as possible, then we want to find birth positions where we can actually allow that tailbone to respond as the babe is moving out by getting out of the way. We also need pelvic floor muscles that can respond by lengthening and relaxing and opening. So when we're talking about Kegels in pregnancy, yes, we want to do them to keep that group of muscles strong, but in the final weeks, what I have my clients do is modify that a little bit. So it's like birth prep Kegels. So if you've watched my core breath video, you know that I teach an inhalation to expand, and by expand I mean expanding in the ribs, expanding in the belly, and expanding in the pelvic floor. And then on the exhale, we think about, I'll use the model here, we think about the edges of those pelvic floor muscles, the edge of that diamond, coming together and then lifting up into the body. That's the exhalation, and then the inhalation is that blossom and that open and expansion. So in the last few weeks of pregnancy, what I have my clients do is practice inhaling to expand, allowing the edges of that diamond to really reach, to blossom. And then when they exhale, they're going to practice keeping that expansion. So instead of drawing the edges together, they're going to keep the edges open. So it's an inhale to expand, and then it's an exhale to keep that expansion. And imagine, because that's what we have to do when we push, when we're pushing our babe out, we are exhaling, but we don't want to be drawing those edges together while we do so. We want to be able to open and surrender and relax. So the more we can practice inhaling and then exhaling while keeping that space open in those last weeks of pregnancy, the more likely it is that that will translate to our pelvic floor muscles being able to respond appropriately in labor as well. So yes, Kegels are important, very important in pregnancy. We want to have strong muscles, but we also want to have supple muscles that can lengthen, that can surrender, that can release tension. So a balanced training program in your pregnancy is key. And one last thing, when you are recovering, so once you've had your baby, Kegels really are your very first exercise. It's the first recovery exercise that I have my clients do. Calling it the core breath is usually what I do. So if you haven't watched my video on the core breath, go do that now. But once you're, within the first 24 hours, you want to go back to inhaling and expanding, and then exhaling and drawing the edges of that pelvis, the edges of the diamond in your pelvis together. Or imagine picking up a blueberry with your vagina and your anus. Or imagine sipping a milkshake through a straw with your vagina and your anus. If your vagina is tender after you've given birth, which it will be, then if it's too much, if it doesn't feel comfortable to be able to actually voluntarily activate those muscles, then just visualize it. Visualize the blueberries or the milkshake or the edges of the diamond on your exhalation, and then really focus on that inhalation and expansion. And then as soon as you can, as soon as it feels comfortable, add in those voluntary contractions. It's a great recovery exercise because it stimulates muscle memory. It helps circulation, so it's going to help bring important blood flow to the area to help heal. And it's also going to stimulate nerve growth factors. So during birth, we do have stretch and pressure against the nerves. They go through a tremendous amount of stretch and pressure, especially in a vaginal birth. So we really want to make sure that we can stimulate the nerve growth factors, so any nerves that have been compressed or potentially slightly injured in childbirth will have a better opportunity to regain full function the sooner we can get that activity happening again. So there you have it, Kegels in pregnancy. Yes, you should do them, but make sure you do them with the modification.